Hi, my name is Emily Monto, and this is my husband, Richard Wusek. We're here to share our story of how we started with an unfortunate situation and now have been helped gratefully by RIPIN.
Took it upon myself to research and go on Health Source RI website to try to find a healthcare plan that would be suitable for our family. I spent a better part of a day reviewing programs and plans and thought I had narrowed it down to a couple depending on what it was going to cost us and what we could afford, and that's when the phone call started.
While this was going on, I mean, it was like 6 months into it, we just assumed we had the same insurance as his friend who informed us to get this insurance. And I went to my regular PCP appointment and they looked at me like, this isn't a Rhode Island insurance. I said, oh no, this is a Rhode Island. And they're like, they thought I meant like a Medicaid. And I said, no, it's not Medicaid. It's Rhode Island insurance. I have breast cancer, so I had to meet with a surgeon. Once I had the appointments with the surgeon, the hospital contacted me saying that these procedures aren't covered. I spoke with someone from the hospital that was going to try to help with the bills because I would have to be I was considered private pay because my insurance would cover nothing.
Emily and Rick came to me. They were scheduled for a Health Source RI open enrollment event for coverage in 2024. As a certified navigator, I was assigned to help them at the event. And when I spoke with Emily, she had explained a little bit about her situation. After I completed the enrollment for 2024 coverage, I realized that I think that there was more that RIPIN could do. So I looked into other situations where consumers were misled. In a lot of the cases that I found, it was sham health plans that consumers thought that they were purchasing true coverage, but they were really purchasing just, fly-by-night policies that did not offer the things that they're supposed to cover, like preventative services, like Emily mentioned, mammograms, things that true health insurance policies will cover. So the Federal Trade Commission actually took action in those cases, in those states, and allowed consumers to have what's called an exceptional circumstances SEP, or special enrollment period. When I saw those cases, I said, this is perfect for Emily and Rick. Like, this is what they need. We ended up reaching out to our friends over at Health Source. I presented the cases that I had found and I asked, are you willing to help this family? And they literally said yes. We were able to get all of 2023 covered under their Blue Cross plan that they selected for 2024.
But now I can tell that I have help. I can see through, a $10,000 radiation bill that over $9,000 has been covered.
Emily is, always one that's always, somebody needs to help us. Somebody needs to help us. And she'd always praise for help, and we got it. And I appreciate it.
Yeah.
Thank you.
We're very thankful.